Good afternoon, everyone. I am Johanu Botha, Operations, Logistics, and Planning Lead with the Vaccine Implementation Task Force. As of today, we have administered almost 260,000 doses of vaccine to eligible people across our province. This means that nearly 18% of adults in Manitoba have received at least one dose of the vaccine. I want to be clear that each and every dose that has actually arrived in Manitoba or is confirmed to arrive in our province is spoken and planned for. Every dose will move through our system to be delivered within a week if that dose is traveling to a super site, or a bit longer if that dose is traveling to a pop-up clinic or with a focused immunization team. In addition to those 260,000 doses that are now already in arms and protecting the people around us, we have also supported our First Nation partners with around 40,000 doses for their immunization campaign, and we have delivered over 50,000 doses of AstraZeneca Covishield to medical clinics and pharmacies from the last shipment of AstraZeneca Covishield. All of the remaining doses, around 55,000, will be used in our super sites, pop-up clinics, and by our focused immunization teams. Those doses aren't with us for long. They will be with us for less than 10 days. In fact, the task force will have no vaccine left within 10 days unless more supplies arrive from the federal government. Remember that our system currently has a balance of large vaccine pipes, our super sites, that work through vaccine very quickly, and smaller vaccine pipes, our pop-ups and focused immunization teams that take a bit longer, but reach Manitobans in remote or vulnerable settings. Super sites give us speed, and the pop-up clinics and focused immunization teams help us to ensure our most vulnerable people have access and that we can bring the vaccine closer to home for many people. About 6,500 doses are booked at our super sites, pop-ups, and focused immunization teams today. It's clear, though, that vaccine supply still continues to challenge us. Last week, I told you that a Moderna shipment was going to be delayed in getting to Manitoba. As a result of that delay, we had no choice but to postpone a number of pop-up clinics that were expected to run across the province. There were no other vaccine that we could have shifted over to cover that shortfall. Shifting from pop-ups to super sites, you might remember that we had initially said our plan was to put as many as 13 super sites throughout our province, and we're well on our way there. I'm pleased to announce that our next super site will launch in Winnipeg early next month at the Winnipeg Soccer Federation complex on Lila Avenue. The Lila super site is expected to open around May 7th based on our vaccine supply, and will have a capacity to do more than 4,000 doses a day. The details of additional super sites are also being finalized, so I expect to provide more news on that very soon. Before I turn things over to Dr. Reimer, I have one final thing to touch on, which is the online dashboard we use to report to Manitobans about our progress in the immunization campaign. Our goal is to provide a complete, timely, and accurate picture to you. But one of the ways we responded to the challenges at the Winnipeg super site was to put data entry temporarily to the side as we focused on reducing wait times and better processes for our clients and our staff. As a result, our dashboard got pretty far behind, as in thousands of doses a day behind. Our team has been working very hard for the last few days to help catch us up, and we'll ensure that we stay caught up. So you'll likely see that online dashboard shifting today as that work is done, capturing the full 260,000 doses that we have administered in Manitoba. The dashboard will be updated to reflect doses administered, delivered to our partners, how many vaccine appointments are booked at our sites on any given day, the percentage of adults who have been immunized, and how soon we will run out if the federal government doesn't send more. This immunization campaign is to help protect all of us, and our team, as well as our amazing partners, are well on our way to doing that. And with that, I'll pass it over to Dr. Reimer.
Thank you. Good afternoon. I'm Dr. Joss Reimer, Medical Lead for Manitoba's Vaccine Implementation Task Force. Today, I am pleased to announce that we are expanding eligibility again at our super sites to include people over the age of 60 and First Nations people age 40 or older. Aujourd'hui, je suis heureuse d'annoncer que l'admissibilité à la vaccination dans nos supercliniques est de nouveau élargie pour inclure les personnes de 60 ans et plus et les membres de Premières Nations de 40 ans et plus. I also want to highlight again the eligibility criteria for AstraZeneca or Covishield vaccine, since we have distributed more than 50,000 doses to medical clinics and pharmacies across the province. This vaccine is for people aged 55 to 64 who have a serious health or medical condition that puts them at higher risk for severe outcomes related to COVID-19. There is a complete list of those prioritized conditions on our website. The AstraZeneca vaccine can also be used for people who are 65 and older, and we've asked the providers to prioritize those who may face challenges or barriers to going to a super site or a pop-up clinic. If you are currently eligible to be immunized, I encourage you to make your appointment and get your vaccine as soon as possible. Case numbers have been increasing in Ontario and Saskatchewan due to the increase in cases related to variants of concern. We've seen that variants can have more serious side effects on younger people. We're now starting to see our case numbers increasing overall in Manitoba. It looks like we're in the beginning of a third wave. Right now, this means that the actions of all Manitobans are critical to ensure that we continue to protect each other. Reduce the number of contacts that you have. Stay home as much as possible. Wear a mask when you're with people from outside your household, even if you're outside. We need to take these steps now. Enforcement of public health orders will be active this weekend. Because if we can't control the transmission of COVID-19, Manitobans may see more restrictions in the days ahead. I also want us all to get vaccinated in order to protect the most vulnerable folks in our communities. So on top of thinking about your own eligibility, I ask you to think about your parents and your grandparents. Think about your friend who's getting chemo or your niece with a weak immune system, and imagine if they were to get COVID. That double effect of having a pre-existing health condition can put them at a very high risk of being hospitalized or even of dying related to COVID. Consider also what would happen with your children or other people in your life that you care for if you were to become ill. I grew up in a small town in Manitoba, so I've seen firsthand how much our communities can take care of each other. And if we all get immunized, then we are much less likely to pass the infection on to others. We can protect ourselves, we can protect our families, and we can protect Manitoba. Ayant grandi dans une petite ville, je suis bien placée pour savoir à quel point nous nous soucions du bien-être de nos communautés et de chacun de leurs membres. Si nous nous faisons tout vacciner, nous serons beaucoup moins susceptibles de transmettre l'infection à nos voisins. Protégeons-nous, protégeons nos familles et protégeons le Manitoba. While I have this opportunity, I want to share one of the stories that really affected me when I heard it both as a doctor and as a member of the task force. We recently planned pop-up immunization clinics for group home residents who are part of the Community Living Disability Services program. Their clients are adults with intellectual disabilities. We received a note from a staff person who was there and wanted to share how great the day was. He said that the kindness of the staff and their ability to adjust the immunization routine to meet the needs of these vulnerable people was nothing short of amazing. He told us that what could have been a frightening or stressful experience was instead a really wonderful experience for the clients, for their families, the staff, and everyone involved. One of the immunizers that we spoke to told us that the room was full of positive energy, and so it was just so wonderful to hear that. And I want to send out a huge thank you to the team that was involved, from all of us on the task force for the great work that you did. And a thank you to the Manitobans who came and were immunized and put their trust in our clinic. So on top of that, I want to talk about a telephone town hall that we'll be holding. So Manitobans are invited to join Johanu, myself, Minister Stephenson, and Dr. Roussin at a telephone town hall happening next week, where we will answer as many questions from you as we can. There is a session next Tuesday evening for rural and northern Manitoba, and there's one on Thursday evening for Winnipeg residents. To participate, you can sign up at engagemb.ca, and we hope that you will join us. Ayant de passer aux questions, j'aimerais rappeler une dernière fois que les Manitobans sont invités aux assemblées publiques téléphoniques de la semaine prochaine. Monsieur Botha, le ministre Stephenson, le docteur Roussin et moi-même tenterons de répondre à autant de questions que nous le pourrons. Il y aura une séance mardi soir pour les résidents des régions rurales et du Nord et une autre jeudi soir pour les gens du Winnipeg. Pour participer, vous pouvez vous inscrire sur le site engagemb.ca. Nous espérons que vous vous joindrez à nous. Before we close, I just want to be clear that we are in the beginnings of a third wave in Manitoba. So your actions are critical right now in order to protect yourself, protect your community, and to avoid further restrictions in the near future. The vaccine is a path out of the pandemic, but let me be really clear that we are not there yet. We have to continue to be vigilant. So please keep wearing your mask, limiting your contacts, following public health guidelines, and follow the fundamentals. With that, I would like to open to questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Brandon Sun, Colin.
Good afternoon. I'm not sure who has to answer this one, but we've had some complaints from people in rural communities in West Man that access to vaccination sites has been difficult because of the length of trips to super sites or clinics, and in last week's cancellation of pop-up sites because of Moderna shipments being delayed has only made things worse. What's the province's plan to get back on track with vaccinating rural Manitoba, and what's the timeline like for that?
Thanks for that, Colin. So there's always a balance, I think, as we've said, between the fast and sort of highly efficient super sites that can get doses into arms quickly, and then the other tool in our toolkit, or the other pipe, which is a pop-up or a focused immunization team, which is slower but can serve a more remote or vulnerable population. So it was unfortunate that that delay occurred in the federal shipment and we had to cancel those pop-ups. As we get greater confirmation on when that shipment might actually come in, we will certainly look at how best to serve Manitobans in that area. But the operational team will have to be sensitive to direction we get from the medical side. And as the epi is changing, as the epidemiological direction is sort of leading us towards getting more doses into arms faster, we may have to look at using bigger pipes for that Moderna. So while pop-ups will remain a key part of our process going forward, the full extent to which we use them will have to depend on how this virus spreads and whether we continue to emphasize the remote and vulnerable Manitobans to the same degree we have, or do we shift our balance a bit and really start focusing on erasing vaccines into arms? We can do either. We have plans in place for either, but we have to see what happens with this third wave and what direction we get from the medical side.
Thank you. Our second question for today comes from a reader. We had a woman call. She's a concerned mother. Her daughter works in a pharmacy, and she's worried that her daughter hasn't received a vaccine despite the pharmacy having being open to vaccination and having a lot of people come in. Will there be any sort of program to prioritize the vaccination of pharmacists and people at clinics who are administering vaccines?
Yeah, I can take that question. Pharmacists and the other employees that work directly in the pharmacy are already eligible for vaccine. So on the Protect MB website, we do list the eligibility criteria, and so anybody who works in that setting would be eligible to book through our online booking tool or by calling the call center.
From CJOB, Clay.
Yeah, good afternoon. Just wondering, Dr. Reimer, if you could expand on your previous comment that Manitoba is definitely now into a third wave of COVID-19?
Yeah, so I mean, the numbers that we're seeing today are higher than we had seen in the past few days, and they had been slowly increasing over the past few days as well. We've also seen that the proportion of our cases that are variants of concern has been increasing. And so we need to be very cautious as we see these numbers start to creep up. And we don't want to delay response while we wait to see what happens. So I know that the entire public health team is working today, as they do every day, to analyze the situation, to look at what happened in the other provinces who were ahead of us in this third wave, so that we can respond appropriately in Manitoba. But I think it's starting to become clear to us in public health that these increases over the last couple of days are the initial signal that this could be starting in Manitoba.
Okay, a quick follow-up, and that's regarding the first shot. Can someone speak to us about, because a lot of people, more and more people are getting that first shot now. They're going to wait for the second shot, but I'd like to ask about the efficiency of the first shot. How long is a person protected for the one dose? How much protection does that one dose provide as opposed to getting the two doses?
Yeah, that's a great question. So when we decided to delay the second dose, we did so because we didn't have enough supply to be able to provide doses to all Manitobans as quickly as we wanted. Our goal is certainly has been and continues to be getting as many Manitobans protected as quickly as we can, especially as we're seeing these third waves in other provinces and the third wave starting here now as well. So more than ever, it's critical that we focus on the first dose, because the more of us that are immune, the less opportunity there is for the virus to move throughout our community. So the studies that we based the decision on to delay the second dose came from BC, Manitoba, Quebec, the UK, and Israel. And all of them showed that the first dose in real-world effectiveness provided either in the 70s or in the 80% protection, which in real-world numbers is highly effective. So we were very satisfied to see that after one dose. We would be happy to see effectiveness in the 80s after two doses when we're talking about the real world compared to a trial. So that was the first thing that was very reassuring about all of those studies that we saw. The second reassuring aspect was that the immunity lasted for the entire length of the studies. So the studies were not very long because we hadn't had the vaccine for a long time at that point. But even the longest ones being 2 months, there was no decrease in the immune response at that 2-month mark. And we know that our immune system isn't going to just change overnight and suddenly, the next day we're not immune to the virus. So we felt confident that we had a clear minimum of 2 months protection, a very, very strong likelihood that we have a 3-month protection, but we truly think it probably will last more like 6 months if we look at data from other vaccines and how long we see responses to them in similar circumstances. All of that said, that doesn't make us stop paying attention. So if we at any point in Manitoba or in any other jurisdiction start to see signs that that immunity is going away, then we can move towards starting the second doses for the most vulnerable Manitobans. For today, most jurisdictions are still seeing good protection after 1 dose. And the best way for us to prevent this third wave, or at least prevent it from being larger than it needs to be, is to have as many people immune as possible. And so even for those folks who have to wait for their second dose, they will be better protected if all the people around them have also received a first dose. So we feel very comfortable with the continuing of that process for now, but we will never stop evaluating the science and making decisions as it comes in.
From the Winnipeg Sun, Glenn.
Yes, Glenn Dawkins from the Winnipeg Sun. With the reduction today in the eligibility to age 60 and over, is there any thought of perhaps creating some kind of a wait list where if you are not eligible currently but might be eligible next week that you can get onto a wait list? Has there been any consideration on doing something similar to that?
I can take that one first, and then pass to Dr. Reimer if there's anything else. The way that our system works is that we drop down eligibility at a rate to ensure that there is enough appointments available for that next cohort that we open up. And then as we get through that cohort and as more vaccine arrives, obviously we go to the next age list. So in essence, we've built a system where we're all on the wait list. We're all waiting, but everyone's time will come. And it's a smooth process. The moment someone is eligible age-wise, then they can book an appointment. So I think by default, we have a wait list. We're all on it.
Yeah, I'm also going to add that if people go to the Protect MB website, you can sign up there. And while it's not a wait list quite like you're describing, we will notify people when they become eligible. So it is an opportunity for people to get that notification as soon as eligibility changes and includes them. So that is an option for people as well.
My follow-up, earlier, the briefing earlier this morning, the expectation seems to be that we'll get to 70%, I think was the figure, of Manitobans immunized by May 21st. With the challenges with getting vaccine from the federal government, as in getting the vaccine in, is that a realistic goal? Or how realistic do you think that goal is?
So I can take that one. Thanks, Glenn. So, and it's precisely for that reason, the reason around volatility of federal shipments coming in and not knowing for sure both when a projected federal amount will come in, but also will it come in sort of one big lump early on in the quarter? Will it be distributed more evenly, or will it arrive later on in this quarter? It's for that reason why we have two scenarios. We have the ideal case scenario, which is the one that you reference, which hasn't changed for a while now, but it's still the case that if we get the supply in at the ideal rate, we will have all eligible Manitobans with an opportunity to have a first dose assuming a 70% uptake rate. So assuming that 70% of eligible Manitobans want to get the shot. We do have the less ideal scenario still there, so which is mid-end of June. So we're constantly working within that range, mid-end May to mid-end June, for eligible Manitobans to get that first shot. And there's a question on this morning as well, but because we work within a range, that's why our specific age eligibility that we're at the moment, with 60 and then 40 for First Nations, why it may not perfectly align with what the age should be if we were going perfectly towards the ideal scenario, or what the age bracket should be if we were sort of going slowly towards the end of June. The reality is we'll probably be somewhere in between those two goalposts. Obviously, we'd like to be closer to the May one than the June one.
From CBC Manitoba, Bart.
Hi, Mr. Botha. I see on the dashboard we've got 6,583 doses scheduled for today at the super sites, pop-ups, and the mobile teams. This morning I was asking for all those three categories together, what's your daily target for the coming week?
So what we got for you is we didn't get the daily target. We gave you the full week because it will vary each day depending on how many fits are going out or how many pop-ups are up. But right now for this for April 5th to April 11th, our plan is 45,000 and a half total for super sites, fits, and pop-up clinics. And then for the week of April 12th to April 18th, it's about 40,000 doses planned, super sites, fits, pop-ups, clinics. And the reason it's a bit lower, it's 40,000 for the week of April 12th to 18th, is the lower planned numbers due to the canceled pop-ups because of the delayed Moderna shipments. If we look back, the week of March 29th to April 4th, we administered just over 50,000 doses across those three channels, super sites, fits, and pop-up clinics. Of course, they don't include the doses administered by our First Nation partners or physicians or pharmacists.
Thank you for that. And when we look at the lump sum doses, obviously you went up 25,000 in one day. That wasn't all done yesterday. That was part of the catching up. You're talking about going to 9,000 on average by the end of the month. Is that 9,000 just those three categories, or is that also going to be including the First Nations doctors and pharmacies?
No, it's just our categories. It's just our categories. And yes, it was quite a bit of heavy lifting to clear up that data log. We certainly, I think, felt the pressure of our stats not being accurate. It's nice to see that they're accurate. We are behind only the biggest provinces in Canada in terms of total doses administered. And our goal is to ensure that data remains up to date.
Thanks for that.
From the Canadian Press, Steve.
Oh, hi there. I'm just wondering, I know the amount given on a daily basis obviously varies depending on getting the fit teams and the pop-up clinics out to certain areas and the extent to which they're attended. But can you give us an idea as to what your maximum daily amount so far has been given? What's the most we've given out in one day?
It's a good question, Steve. I should get the hard answer to you after this. I'm guessing it's probably around 10,000 or just below.
Okay, thanks. And yeah, and I see going forward, the briefing we were given today, this morning, it pegs or it predicts several days where you're going to be above 8,000 a day when you've got the fits and the pop-up clinics going, as well as the super sites. Can you tell us what the plan is for more super sites in outlying areas?
Yeah, so what I can definitely say is that every single region, by region I mean the region that corresponds to the Regional Health Authority, will get at least one more super site. The one that we announced today was the one for the Winnipeg region at Lila. Every other region will get one. and I will be able to announce both the community and the specific location very soon. As you can imagine, we want to have that announcement made when both our municipal partners and our regional health authority partners are all ready and well aware, so that there are no surprises and all our plans are in place. But we are committed to achieving our 13 super sites total, and I will have hard information on that very soon.
From CTV Winnipeg, Michelle.
Hello to you both. A question for you about the third wave. When would we consider adjusting things like vaccine eligibility, getting younger people vaccinated, essential workers vaccinated because of variants, and then also from a logistical perspective, Johanu, you touched on this earlier today, and you said, we could change it if we get to, if we're urgent. Like, are we not at that urgent point now to start considering other strategies?
I can take the last question. I'll take the last question first there, Michelle. So the point at which we can pivot to using bigger pipes more, bigger pipes is the metaphor I use for essentially super sites or versions thereof, will have to come from the medical side. So we as we talked about this morning, we have tools in the toolkit that can serve remote or vulnerable Manitobans, but they will go slower. If the medical direction is such that it might be more beneficial to just get all doses in arms faster and maybe emphasize less those sort of remote type populations, then we can pivot. We're ready. We have plans in our back pocket, but we need to support the medical strategy first and foremost. So I think that's over to you then, Reimer.
Yeah, so I would say we are looking at this all the time. As the third wave is starting in Manitoba, our numbers are still quite low compared to other provinces, and so it's difficult at this point to identify clear trends when we haven't had high numbers for a while, which is a very good thing. I'd much rather have low numbers and not be able to identify any trends. So what our epidemiology and surveillance team is doing, along with some of our medical officers of health, is doing a scan and connecting with the other provinces to get more of an inside look at the trends that they're seeing, so that we can try to predict what we might see here in Manitoba. If we see that there's a clear trend where a new population is at higher risk than what we saw when we made the initial decisions, we will absolutely change our approach and ensure that whatever population is experiencing those severe outcomes is prioritized. So I don't have an answer today about any shift in our priority. So far, what we've seen in Manitoba still shows us that older Manitobans are at highest risk, and so we still want to make sure that we get everybody over 60 immunized as quickly as we can. But the team is working on that as we speak, and as soon as I have more concrete data, I will be happy to announce any changes that we need to do.
Thank you. A question about AstraZeneca. So we know we got 56,000 doses last week. We're expecting another 11,000 this week. But I'm also hearing that beyond that, we don't know how many AstraZeneca doses we're going to get, and that you're kind of reallocating or you're changing how you allocate the ones that are coming. So can you just explain to me what's going on behind the scenes and when these doses are going to be going out?
Sure. So the process that we follow with our pharmacist and physician partners is, first of all, there's not enough vaccine to go around. We would like to send way more to clinics and pharmacists than we can. So we have to go through a process where we allot a certain amount to each clinic or pharmacist based on, geography. So it's distributed across the province. We look at those who serve sort of a more vulnerable population. And also we look at those who have a high throughput, their ability to administer a lot of these vaccines, because obviously we have an interest to get those vaccines in arms. So we look at all those things, and then an allotment is given to a pharmacist or a physician clinic who are happy to take it, and then we ship it off. In terms of that shipment process, it happens fairly quickly. We got just over 55,000 last week, and it was over a course of a few days that we had it all out to those locations for the most part. And that was after we had pre-positioned supplies like syringes as well. For the 10,000 that's still coming, it's delayed. It will not be coming today. That we found out relatively recently that it won't be coming today, so we're watching for when it comes. We'll follow that same sort of process. It's been earmarked for a certain clinic or pharmacist. So then we'll ship it out right away. It should get there very soon because it's a small batch. And then from then on out, we don't have any hard confirmation. So I don't think we can commit to when we're sending them out because we don't know when we'll get any more AstraZeneca.
From City News, Jonas.
Good afternoon, folks. Mr. Botha, being with you this afternoon on some of the new data we are going to see on the dashboard today. Do you mind just kind of walking through us what we will see and how we should interpret it as it pops up? Yes,
absolutely. Thank you for that, Jonas. So the new dashboard, when it opens up or when it's live, it might be live as we're speaking. It'll show our total doses administered. Of course, we want to show that that's our main progress indicator. We'll show how many Manitobans have been vaccinated. It gives us a sense of how close we're getting to that herd immunity. And then we wanted to provide a sense of what we've delivered to our First Nation partners and what we've delivered to what we call our distributed channel, or but it's clinics and pharmacists. So that'll be broken down so that Manitobans can see, what's delivered off to First Nations, what's delivered off to docs and pharmacists, and then what does the task force, so to speak, have direct control over in terms of what we need to pump through super sites, fits, and pop-ups. And then below all that, we'll show you that for those doses that we are in direct control of, how fast will we run out of them. So there'll be a day figure on there that shows Manitobans, if we don't have a new federal supply coming, how fast will we run through the supply on hand. And you'll see that figure will probably move from between 4 or 5 days at the shortest to sort of 10 days at the max. If we used only super sites, those days would be shorter. The more we add pops and fits by design to serve remote and vulnerable Manitobans, those days will be a little longer. So that's the main piece that you'll see on the dashboard. You also see the doses scheduled for the day, so Manitobans can have an idea of any given day, what do we have planned for that day. Again, for super sites, pop-ups, and focus immunization teams, we won't speak for our physician, pharmacist, or First Nation partners on those appointments, but that'll be up there. And then there's this an array of tabs that I won't bore you with, but that Manitobans can go to and click on the tabs to get to sort of even more data and analytics on what it is that we do and how we do it.
Thank you for that, sir. Dr. Reimer, just want to touch base on kind of what the theme that's driving the vaccine rollout. When the province first launched it, it was equity. Maybe just a message on how this is shaping how the vaccines are flowing out.
Yeah, we have several goals that we want to keep in mind at the same time. So one is trying to get as many doses into as many arms as quickly as possible, because not only does that protect the person who received the dose, but it also protects the people around them. So the quicker we can have many people immune, the better it is even for those people who haven't received a dose yet. So that's one of the aspects. The second is specifically trying to target who is most likely to experience the severe outcomes related to COVID, particularly when we have a low number of doses and herd immunity is not something we can achieve yet. It's important to focus on protecting those people that might end up in hospital or that are at risk of dying if they were to become infected with COVID. So that also is a priority. And then on top of all of that is the equity concerns. And the equity concerns means that we want all Manitobans to have access to whatever they need to have similar outcomes. So that might mean giving more or faster doses to some parts of the province compared to others because of barriers that people face in those areas. And so it's quite critical that we do things like have pop-ups in remote or rural locations because people face more barriers to getting to a super site in those locations. But it's also critical within Winnipeg that we have pop-ups that are in areas that are easy for people who don't have a car, who may not have a job or income and face a lot of challenges moving around the city, or wouldn't feel welcome at RBC. So rather than just focusing at the super site, we need to make sure that even though it's a slower process, it is critical that we have these other opportunities for people who face barriers to get immunized and have that same opportunity for the good health outcomes that we want for all Manitobans. And that's also why we do our focused immunization teams. They reach a very small number of people compared to the super site, but the people that they do reach are those who are at highest risk of severe outcomes and who face the most barriers to being able to achieve good health outcomes generally, whether that's somebody in a personal care home or somebody in corrections or staying in an addiction service treatment program. All of those folks are essential for us to be reaching equitably with the rest of Manitoba. And so you see us sort of push and pull between how fast we can get things out versus getting it to the right people. And there'll always be a bit of movement back and forth between those two as we try to respond to the epidemiology, so the numbers that we know and the trends that we see in the short term and in the long term.
From CHVN, Taylor.
Hi, good afternoon. Now that we are creeping into ages where most of the population is working during the day, what kinds of things are you doing to help fit into those schedules? Are you doing things like making more of those closer to home pop-up clinics or opening up appointments late at night?
Yeah, so I think, the goal is as more supply comes in, that we run our super sites every single day, full day. And then the very nice thing for the operations team is that we'll be, hopefully by next week already be able to announce what the next tranche of super sites will look like and where they'll be. And as I said, there will be at least one more in each region. And so in terms of having an appointment somewhere available that fits an individual schedule with 2 large super sites in their region is probably very, very likely. Especially as more vaccine comes in, they will be able to chug along, day after day, full hours. So there should be wide room as long as individuals can, reasonably access a super site.
Thanks. And Dr. Reimer, you said earlier that you're from a small town, and we see that there's a lot of vaccine hesitancy in these kinds of communities. What have your experiences been like?
Yeah, this goes far beyond COVID. We have seen within Manitoba different vaccine uptake in different parts of the province. And so, my message is to everyone in Manitoba that this vaccine is safe and it is extremely effective. And it is our best way to get out of this pandemic and start to get back to the normal way that we live and socialize and work and run our businesses. So, regardless of where somebody lives, I hope all Manitobans go for their vaccine as soon as they can. I know that life can sometimes get in the way. We have family and work and school responsibilities, but I just ask Manitobans to sign up as quickly as they can when they're eligible and go for that vaccine. Our communications team is working hard to connect with local leaders who can help be those champions for the vaccine in a variety of communities, because I know that there's many people who are going to be more responsive to someone that they know telling them information about how it's safe and effective. So I think it's critical that that we don't just rely on these press conferences, but that we also reach out through those trusted voices to make sure that we reach all parts of Manitoba with a message that they can trust.
Thank you.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Reimer, you said the epidemiology and surveillance team is doing a jurisdictional scan on the impacts of the third wave elsewhere right now. I guess I'm wondering if you can tell the public what to expect about the timeline for a future shift in vaccination targets. So how long do we need to do the jurisdictional scan, and how far into the third wave can we wait before we shift targets if necessary?
Yeah, that's a hard question for me to answer because it really depends on what they see. So if they very quickly see that there's good data from multiple provinces that show clear trends, then we'll have our answers quite quickly. And by the next time we have this press conference, I might be able to announce a shift in approach. But it's also possible that either the details in the data from other provinces are not fully fleshed out yet, or that the trends aren't as clear as we'd like. And that would mean it will take longer for us to ensure that we're prioritizing the right people. So certainly as soon as we have clear trends in front of us, we will move. There's no reason to wait if we know who's at highest risk. But there's also no way for me to predict what the data will show until we've had a chance to see it. But I will commit to Manitobans that if there's an obvious trend, I will work with the team and reprioritize who has access as soon as we see that trend emerging in the data itself.
Okay, thanks very much. And I was wondering if you can talk about the number of COVID-19 infections that have been reported in Manitoba post-immunization, and if we've seen any vaccinated individuals admitted to hospital due to COVID.
So we have had individuals who have been infected with COVID after immunization. I don't have those numbers in front of me, but we can see what we can pull together for you with the team after the press conference.
Our final reporter this afternoon from Global News, Brittany.
Good afternoon, it's Brittany from Global News. When we start looking at the timeline and when we can expect people to get their first doses, we were saying, at the latest we were looking at mid-June. People who are now eligible at 60 are booking 3 weeks out, putting them in May. So people that are, 20 and above would be looking at quite a long time after that. How quickly are we going to be able to add appointments in so that people aren't waiting, 2 months later?
Oh, fairly quickly, and that's part of the benefit of this new tranche of super sites coming in. So if you have another super site in every single region and you have the supply to book the doses, then we will get to a point, hopefully soon, where people don't have to book, three weeks out, and if a new cohort coming in can book sort of within the next week or two, that would be the ideal. And that could happen. That's what the ideal scenario looks like around mid and May. Like I said before, it's probably going to be somewhere between the ideal scenario of mid and May and the less ideal scenario of mid and June.
Thank you. And I know it's tough to compare provinces, but I know that there's frustration that we're hearing from people when they look towards even Saskatchewan, who has similar sizing to us and are doing 10,000 plus doses in a day when we're doing maybe 4,000. They've got the drive-through that they're working in. Is there any reason as to why we are seeing such a difference in the doses being given there in comparison to here, and why we're not also looking at things like drive-through immunization clinics?
Yeah, so I guess the first thing I would say is that nothing is off the table. We're constantly looking at new or different models to administer vaccine. Our approach here is a bit different for a variety of reasons. First off, if you look at how remote and rural and geographically complex a part of our province is, that our neighbors don't deal with to the same extent, we've had to use pop-ups and focused immunization teams to a far higher degree. And certainly our First Nation partners have had to, given the location and the lack of road access communities that they serve. So we've had this, especially earlier on when we had an elderly, more vulnerable population to serve. We had a far greater use of our small pipes, so to speak, pop-ups and focused immunization teams than our neighbors did. So in order to balance that out, the operations side said, okay, for those who don't need the small pipes, let's use the very biggest ones. And the very biggest ones are the super sites. They're the most efficient and effective. And we ran with those. The drive-through option is sort of a mid-tier option. We can certainly look at it, but that's sort of where we landed with our super sites. I would say too, compared to our neighbors to the west, so this is not about a race or a competition between provinces. I think we all have the same goal. We've administered 20,000 or around that amount more than they have, but they've been able to administer more per capita, given that they have a smaller population. So I think we're all trying to reach the same goal here together and learning from each other. And we will adjust, as Dr. Reimer has noted, the moment that there is different medical direction on how we should deliver vaccine and to whom, our planning and operational side is ready.
Thanks, everyone. This concludes our media briefing.